Hello dear patients, today we are going to talk about treatment of prostatitis. We are not going to talk about a whole treatment of prostatitis, but about one of procedures for treatment of prostatitis that is used in our clinic on a particular example. This is electrophoresis. What is electrophoresis? In our case we most commonly use electrophoresis for prostate. This is when different medications are delivered into prostate with the help of electric current from one electrode to the other, from positive to negative one. Of course, we need to know which medications to put on which electrode. A particular example is a patient with chronic calculous prostatitis. I'll demonstrate you how electrophoresis is done. First of all, a special rectal electrode is taken together with a common electrode. This is usually a black plate on which a special bandage is applied and a different medication is applied. On rectal electrode that is shown on the picture with syringe and needle, different medications are administered. We most commonly use lidase medication as this is one of the methods for treatment of chronic calculous prostatitis. On our channel you can watch a separate theoretical video about what chronic calculous prostatitis is. This particular patient has chronic calculous prostatitis. It bothers the patient when these little stones are located around the urethra. In this case they induce unpleasant sensations, burning, itch, discharges, etc. Often chronic calculous prostatitis is a consequence of chlamydiosis, as in this patient. When in dispensaries they try treating with loads of tablets, then the person often gets such chronic calculous prostatitis. In this case, in between these two electrodes, one of which is inserted rectally as is shown on another picture, electrode is inserted into rectum. It is left there. The duration of procedure is usually 15 to 30 minutes. The strength of current is chosen that is necessary and which doesn't traumatize the patient. Then the light electricity is transferred between the electrodes. This procedure is almost painless, so you shouldn't be scared about it. This way medications move from one electrode to the other, thus it gets to prostate. This way we successfully get lidase. As I said before, in this particular case this is lidase, which helps to fight against calculous prostatitis and different antibiotics. It's no doubt that this method is not the only one for treatment of chronic calculous prostatitis. However, it is widely used, particularly in cases when prostate massage is difficult to do. In some cases, urologists use prostate massage during calculous prostatitis, particularly during urethral stones. It can even induce small bleedings, together with discharge of prostate secretion. We have observed this several times, and in these cases massage is contraindicated. However, this is not an absolute contraindication, and it's no doubt that urologist has to solve the problem on his own. But as a substitute and addition to treatment, electrophoresis should be used, and it is being successfully used in our clinic. It is also used when the bacteria that are found in culture test of prostate are sensitive to antibiotics that do not get into the prostatic tissue. For sure, taking some tablets or even using injections is useless. To do a direct injection into the prostate is quite risky. Most commonly, this injection is done through rectum, and it can additionally infect the prostate itself. The method of electrophoresis is quite safe in this aspect, and it is quite effective, as it allows getting high concentrations of antibiotic directly into prostatic tissues. So if it's necessary to diagnose and treat different cases of prostatitis, you can consult urologists of our paid medical center or Dermatov Neurologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such pathologies. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.